Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Karina Leal Vargas, and she is a clinical research nurse at UAMS. And we're talking today about the implementation of a new pilot program about telelactation. Karina, thanks so much for being here.
Thank you so much for having me.
So for those who may not know, can you briefly share your role as a clinical research nurse and how your background in maternal newborn nursing led you to this work?
Absolutely. Yes, like you said, my name is Karina Leal Vargas. I am a clinical research nurse at the University of Arkansas for Medical Sciences. And in my role, I help implement research studies and aim to improve patient care and maternal outcomes. With my background in maternal newborn nursing and through my bedside experience, I saw how challenging postpartum period can be for new mothers. And that's what led me to want to work and be a part of projects like the one we're going to be talking about today.
And so you mentioned challenges. What are those challenges, and what made you feel a new model of support was urgently needed?
So after having a baby, obviously the mom is already going through a lot, not only the physical aspect of having the baby, but their body's gone through a lot of trauma. They're in pain, they're uncomfortable, they're sleep deprived, there's fatigue. Sometimes they have other children at home. So there's a limited time there too. They're dealing with a lot of emotional stress already. Some of these we do see a lot of Medicaid and non-English speaking patients at UAMS, so that adds an additional challenge to receiving care. Those challenges can be around transportation and scheduling barriers to being able to attend an in-person visit.
And why is the postpartum period such a critical and often underestimated window for lactation support?
Because the first few days to weeks after having the baby, it really sets a foundation on breastfeeding success and infant nutrition. Complications like low milk supply or latching problems can happen very quickly if they're not addressed. So timely support can help prevent early breastfeeding cessation and improve maternal confidence.
And before this pilot, what gaps did you observe in traditional lactation care delivery, especially after an hospital discharge?
After the hospital discharge, sometimes mothers leave the hospital without being consistently followed up with. So there's limited outpatient lactation services as well. And lack of accessible care for these patients can really just lead to early breastfeeding cessation, and often these families do end up moving to formula because of that.
What populations or communities were most affected by these gaps, and how did that influence the design of the pilot?
So like I mentioned earlier, we do see a lot of Medicaid families and non-English speaking families. They're often the ones that have the most barriers when it comes to attending an in-person doctor's visit. So we wanted to work with them and offer support to bring the support into their home instead of asking them to come to us for the support that they needed.
And can you walk us through the concept of the telelactation pilot? What it is and how it works from a patient's perspective?
Absolutely. So telelactation, all it is virtual lactation support through platforms like a video call. So we started recruiting patients in their third trimester. We wanted to start building a report and just let them know what to expect from us after they delivered. Once they delivered, the lactation specialist communicated with the patient and started their virtual calls. The first visit being between 24 to 72 hours after having the baby. The second one being at a week, then 2 weeks, and then the last one being around 2 months after having the baby. They did get a pre-survey at the time of recruitment, and then they also received a post-survey once they completed the last visit with the lactation specialist. And after that, we did do a short interview, one-on-one with each patient, to give them the opportunity to just express themselves in their own words, how they felt receiving this support in the comfort of their home, how they felt with breastfeeding through virtual platforms, and how they felt receiving the help from the lactation specialist through a virtual call.
What role did interdisciplinary collaboration play in developing the program?
It played a pretty significant role, honestly. We worked with a large team of nurses. We worked with international board certified lactation consultants, as well as research staff. We work with the IT team and clinical coordinators to put together the design and implementation of this program.
What were some of the biggest challenges you encountered when implementing it?
So some of the biggest challenges, so initially what we had thought about doing is using MyChart, which is the patient portal that UAMS has. And as we started implementing these families, we quickly realized that not all of them have MyChart, one, and then two, sometimes they don't even have an email address, which makes it impossible for them to be able to use MyChart. So we moved away from MyChart and we started using a platform called Doximity, which made it super easy for the patient to use. All they have to do is at the time of their visit, the lactation consultant would send them a text and with a link, and all they have to do is just open the link and connect with her. Another challenge that we came across was that the Spanish population did not feel comfortable doing some of the surveys that we were providing in their third trimester. They felt uncomfortable with some of the questions, and I think it has to do with around the educational level for them. So what we did was simplify the survey, and we created a completely separate arm that tailored around their needs.
How did clinicians and staff respond to integrating telelactation into existing workflows?
So everybody was very supportive. They really liked the idea of being able to bring the help into the comfort of the patient's home, and remove some of the barriers around receiving access to care.
So your early feedback that you've received from mothers who participated in the pilot, also positive?
Yes, ma'am. It was also positive. The families, these mothers felt very supported. They shared that it was very convenient, very flexible, and it helped increase the breastfeeding confidence. Actually, one of the moms, I was just doing some quantitative data yesterday, and she shared that she lives 2 hours away from UAMS. So being able to receive this help from the comfort of the home was very convenient for her. Another one shared that she has 2 toddlers and a newborn, so it's not always the easiest to get them all in the car and go up to an in-person doctor's appointment. So very good feedback for them.
And what outcomes are you measuring to evaluate the success of the pilot?
We're measuring things like breastfeeding continuation and exclusivity. We're measuring patient satisfaction and usability. We're measuring knowledge and confidence in breastfeeding and engagement between across populations.
And how does telelactation support not only the breastfeeding outcomes, but also maternal confidence and emotional well-being?
Well, like we talked about earlier, these mothers are already have a lot on their plate. So telelactation reduces stress and frustration. They know that even if they're not alone. So if they're having issues, they know that in a couple of weeks, or they have the lactation specialist number, so they can text her or know that in a couple of weeks they're going to be followed up with. It helps the mothers feel capable and supported, encourages also continuation of breastfeeding, and improves maternal emotional well-being overall.
And how do you see telelactation fitting into the future of postpartum and maternal child health care? Is this something that you think should be implemented across the state?
I think so. It could be used as a standard of care postpartum for sure. Maybe using hybrid models and mix up in-person or virtual support depending on their needs.
And what advice would you give healthcare leaders considering similar digital or hybrid care models?
I would say prioritize patient-centered care, make sure that we provide flexible scheduling for these mothers, focus on reducing barriers to care and access, and work with the clinics and hospitals administrators to ensure that the program like this can fit in their within their already existing workflows.
Mm. And one last question. What do you need policy-wise, institutionally, to scale this model sustainably?
So I would say offer multiple care options, things like in-person, phone calls, video calls, texting, so that the mothers can choose what feels the most comfortable for them. And invest in bilingual lactation consultants if possible to ensure equitable access. I would say continue strengthening telehealth infrastructure and use user-friendly platforms like Doximity to support secure and reliable virtual care. And also integrate telelactation as a standard of postpartum services and actively increase the patient awareness so families can know that this support is available to them.
Well, Karina, thank you so much for sharing the information about this pilot, and thank you for all the work that you're doing for maternal care and mothers throughout the state of Arkansas.
Thank you so much for having me, and thank you for giving me the opportunity to share a little bit of our project.
That's it for this episode of AFMC TV. Have a great day, and thanks for watching.